Hey, good evening to you. I'm Dennis Owens.
And I'm Kendra Nichols. Valerie and Alicia are off. Well, kids ages 5 to 11 are one step closer to being eligible for a COVID vaccine. Pfizer applied for an emergency use authorization today.
Daniel Hamburg talked with infectious disease doctors, joins us in the ABC 27 newsroom with more. This is big news for parents out there, Daniel.
Absolutely, Dennis and Kendra. Federal regulators are set to meet at the end of the month. 28 million children are eligible, and many parents are anxious to get their kids vaccinated. Pfizer says its data shows that a third of the adult dose gave kids the same level of antibodies as adults.
I think this is another step forward, and I think it's a step that a lot of us in the pediatric community and pediatric infectious disease community have kind of been waiting for.
Dr. Patrick Gavigan with Penn State Children's Hospital is optimistic Pfizer will get approval for its vaccine to be used in kids.
Vaccination is really our only kind of path forward to getting rid of, the masks and all the social distancing, virtual learning.
It's true that most kids who get COVID don't get as sick, but it's not an age group that should be ignored.
We're seeing kids in the hospital with COVID now, almost routinely with symptomatic COVID, some with the multi-system inflammatory syndrome that can happen after COVID.
And higher community spread endangers those with underlying conditions and the elderly.
When you look at pandemics, you look at flu outbreaks, one of the frequent drivers of flu outbreaks is young children.
Dr. John Goldman says even for those who had COVID, it's no substitute for the vaccine.
Studies at UPMC have indicated that getting natural infection is the equivalent of getting one of the two doses of the vaccine series, that it actually produces lower levels of antibodies.
An advisory panel will meet on October 26th to go over the data. After that, it's up to the FDA to give the green light. In the newsroom, Daniel Hamburg, ABC 27 News.